people.
Yeah.
Yeah, wait, I have it. Mr. Smith has been treated with fluoxetine. Am I audible?
Yeah, yeah.
Mr. Smith has been treated with fluoxetine 40 milligram daily for 6 weeks and then venlafaxine 150 milligram for 6 weeks, but has not improved.
Okay.
He is 65-year-old inpatient suffering from major depression. Medically, he has a history of hypertension controlled by ramipril and a history of mild renal impairment. He appeared to comply with this treatment. Your consultant has proposed that he be treated with ECT. He has very little knowledge about ECT and is worried that it might make his memory worse. You are asked to give the patient information about ECT with a view of assigning him in deciding whether he is willing to agree to have the procedure. Address patient's belief, concern, and expectation about the treatment. You are not required to assess his capacity to consent treatment. You are not required to obtain patient's consent.
Okay. So let me know when both of you are ready.
Yeah, I'm ready.
Yeah.
Ready?
Yeah.
Yeah.
Yeah. Enter the station. 1 second. And do your task.
Hello, Mr. Smith. I'm Dr. Kubra, one of the psychiatrists from the mental health unit. How are you doing, Mr. Smith?
Not great, doctor. I don't feel anything. I don't feel good, doctor. I don't find interest in anything. And on top of that, none of the medication is working for me.
Yeah, I'm really sorry to hear about that. The reason why I'm here today is that I'm here today to discuss about this other type of procedure called as electroconvulsive therapy. I'm not sure whether you are aware of that.
I mean, I've heard vaguely about this procedure, but I'm not, I want to know more about that.
Yeah, that's why I'm here. I'm here to explain about that procedure, and if you have any of the concerns, I'm happy to address your concerns. But before that, is it okay, Mr. Smith, if you tell me what's your understanding about ECT?
I have seen in movies, doctor, that they give current. Yeah, I want to know more, doctor. And I'm also wondering, like, you have decided ECT for me. Why do you think will ECT work for me when other medicines haven't?
Yeah, so the information which I have is that you have already been taking 2 medications, and I think that the dose was adequate, and unfortunately that medications did not work for you, although you took them for 6 weeks.
Yes,
So
doctor.
that is where the role of the ECT come into play. So right now we are thinking that we will be giving you some other kind of treatment, some aside from medication. So it has been seen that almost 8 out of the 10 people, they do get benefit from this ECT, those who have not gotten any benefit from medications. That's why we are really hopeful it will work for you.
Okay, so doctor, how does it work?
Yeah, your concern is quite valid. But before that, is it okay if I explain to you about the procedure, how we will be going about this procedure, and
Yeah, yeah, please.
simultaneously I'll be explaining you how does it work? Yeah.
Yes.
So before starting the ECT in you, we need you to sign this consent form, uh, whether you are ready to undergo this procedure. But at any time, if you find that you do not want to get the ECT, you can withdraw that.
Okay.
And for the ECT, you have to come to the hospital into the ECT suite along with
Mm-hmm.
some relative or some attendant who might be there with you. Yeah.
Okay.
And currently, this is a really sophisticated procedure. As you told that you are really fearful about the procedure. I can understand that there are some kind of fears associated with it because of the way how it has been portrayed in the media. But nowadays, the procedure is quite sophisticated, and usually this is given when the person is under sleep. So initially, we will be putting you under sleep. There are the
Okay.
specialist doctors who are there for this, how they will be putting you to sleep just by giving some injection into your arm, into the vein,
Mm-hmm.
and you will be under sleep and you will be quite comfortable. This is just to make you feel comfortable, Mr. Smith. Am I making sense?
Yeah, doctor.
Yeah. So after that, after you will be under sleep, so we will be putting these uh, coin-shaped, penny-shaped coins on both sides of your forehead, right? And then a small electric current will pass through these coins, like for 1 or 2 seconds.
Mm-hmm.
And now the question of how does this work? After this electric current passes in your brain, so it will cause the release of these happy chemicals in your brain. So these chemicals makes a person happy. Yeah, this is
Mm-hmm.
how it really works. And your body will be having some fits, but those fits will be controlled and brief, like for only some seconds, like 30 seconds. So this is how this whole ECT works.
Okay. Okay, doctor. So how many treatment ECT you will give me?
Yeah, so on an average, we give the patients like around 6 to 12 treatment therapies, but we really don't know. So it depends upon your progress, how you're progressing. Sometimes, unfortunately, we might need some more treatments, or sometimes we might need less than 6 to 12 treatments. So it really depends how you are progressing on this treatment.
Mm-hmm. And doctor, I'm actually concerned about, are there any side effects?
Yeah, just like any other procedure, ECG does have some side effects. Is it
Mm-hmm.
okay if I explain to you what can be the side effects?
Yeah, yeah, doctor, please.
Just after the procedure, you can have some feelings of throwing up, dizziness, feeling confused, headache. But don't get worried about that. After the procedure, you will be in a recovery room and there will be a nurse there who will be seeing you. If you feel any kind of headache or any kind of muscle pains, they can give you medications. And
Mm-hmm.
sometimes, unfortunately, we have seen it can affect the memory.
Yeah, doctor, I've heard about, because I heard that it causes memory problem and you lose your memory. Is it something like that?
Yeah, I can understand where you're coming from. So sometimes it does have an effect of memory on memory, but it's usually short lasting. And usually
Mm-hmm.
those memories of recent events, for example, when just
1 minute.
before the procedure, if you are having any conversation with anyone, these are the memories which can be affected. But usually in some days or weeks, you will be fine with your memory. But again, I need to emphasize sometimes these effects can be long lasting, but it's very, very rare. But I
Mm-hmm.
need to tell you this thing also.
So can you do anything to reduce that memory problem?
Yeah, if we see that we will be assessing you for the memory also with time. If we see that we are coming up with that problem, that's a problem there with memory. So what we can do is that in the beginning I told you that we use these two coins which are put on both sides of the forehead. So we can use only one of it. So it has
Mm-hmm.
been seen that if we give the ECT on only one side, it can decrease some of the problems with memory.
Okay. And doctor, I'm having actually blood pressure. So can it affect my BP?
So ECT, during the procedure, there can be some fluctuation in the blood pressures,
Time up.
but I told you, thank you.
Okay. Now let's come to the feedback. Yeah. So, see, one thing I would like to say for most of the sessions which I've done till now is, like, although all of you know what to talk, but the communication is lacking. Actor says something, you are saying something because you are so preoccupied with what you have to go and say. When you start with the ECT, what is ECT? It is electroconvulsive treatment. Yeah, that was not explained. So you should explain that first. Yeah, always address the actor's concern. If the actor is saying that it started with, okay, what do you know about ECT? So I know something, but I would like to know more. That's how it started. Yeah. So either you say that, okay, can I ask what do you know about it? So that is the way I am communicating. Okay, because I'm actually starting from what where the actor ended, not going with my own thing that, okay, let me tell you what happens on the day of ECT and the whole procedure. Remember, nowadays you get actors who won't say anything, who will just keep mute in the whole station. Practically anyone with whom you are thinking about starting ECT will be very, very depressed. So in practical scenario, you will have a patient who will not say anything. Only then you are thinking of ECT. The person is actually at grave risk because of depression. So don't expect the actor will be so forthcoming and asking you all the question, very excited, saying that this all happened, I have seen in the media. You won't see that. Many times I know of stations where the actor was just mute, was not saying anything. So you have to keep checking, would you like to know this, would you like to know that, and then that's how you have to communicate. So if the person is saying, I know some bits but I would like to know more, I would check there itself. Okay, that's great that you know some bits about it. Let me start by saying that ECT stands for electroconvulsive therapy. Can I ask what is your understanding of the procedure so that I can explain more? So you see, I'm actually starting by understanding what the person knows and then building further on that. Okay. Now, how does it work? You should explain that in the beginning when she's asked that. So, first of all, it's not only one hypothesis which explains about ECT. There are different hypotheses. Okay. The whole idea that it works on the happy hormone is a old concept. So you should say that nobody exactly knows how it works. There are different hypotheses. One of it is what? Just be very simple. It acts on the area of the brain which is involved in depression. They say some hypothesis says that it resets the chemical imbalance in the brain, the chemical imbalance which actually happens in depression. In turn, it makes you feel better, think better, and your quality of life improves. So you just say in a layman term how the other person would, you know, take your information. Now, the thing about, the explaining the procedure before, many actors will say, Doctor, I don't want to know the procedure. So I know because you have learned it that, okay, the person is taken to an ECT suite and then there is a team of professional and then you are given the injection. All that is like many people don't want to know. But because you've learned it, you have to say that. So you are not listening to what the actor is saying and just coming with your own agenda. Okay. And believe me, 99% people will go and say the same thing. If you want to pass cask, you should be above the average. Okay. So 99% students will go and say the same thing, what you are saying. Okay. The other thing, you said that I know you've seen it in the media, you heard it in the media, you are scared. I'm sorry if I missed that, but I don't think she said anything that I'm scared because I've heard it in the media. So be very careful. Okay. If the person has not said anything, because the actor can, bounce back and say, Doctor, I never said that. Okay. So be careful. Just because it is written doesn't mean you have to say it. Okay. Then what are the side effects? So she asked you what are the side effects. Then again you said, Doc, is it okay if I explain the side effects? Okay. Again, it just shows that you're not actually listening, you're not actually communicating with the person. Start with, okay, like any procedure, these are the side effects. There are some short-term procedures, short-term side effects, then there are some long-term side effects. Okay. Immediately after the procedure, you may feel a bit sore in your muscles. Okay. You can have a bit of a headache. At times, people can be a bit confused, but there's nothing to worry because you will be in a supervised environment. You'll have nurses and doctors looking after you. Okay, they'll make sure that you're all right. These side effects go away with time. At times, there are some long term side effects where you can have problems with the memory. Okay, now the question about memory, whenever they say, okay, I'm worried about the memory, you can start by reassuring that before and after every ECT procedure, actually you should be making a memory, sorry, you should be monitoring the memory. So say that we will be monitoring the memory. Okay, most of the time memory problems are short lived. In case this continues to be a problem, instead of giving ECT to both sides of the brain, we can give ECT to one side of the brain, which is called unilateral ECT. So that is, let me tell you, that is less effective. However, it has less impact on the memory. Okay. The thing about the hypertension, again, many people can ask, Doctor, I have hypertension. Can I still go through the procedure? Again, you can say during the procedure, whenever they give you new information, say, thank them for the information. Say, thanks for sharing this information. That's very helpful. During the procedure, your blood pressure can rise. However, there will be doctors, you know, there'll be a team of doctors, you can say. There'll be medical professionals. I'll be there as a psychiatrist. Plus, there will be anesthetist. Okay, the doctors, who monitor that or who make sure that you go to sleep before the procedure. So they will all be there to look after that. So if the blood pressure rises, appropriate medication will be given, because never say that it will not rise. Some, I have seen some candidates say that no, no, that's it won't rise. It does rise during the procedure, but then there are people to look after that, and then it's not long term side effect. Okay, is it clear?
Yeah, I have a question.
Yeah.
So, basically, we have to address the patient concerns. That should be our priority. So, while addressing the concerns, if we miss any of the, because her question was, how does it work? And I started with the procedure as such. So, if I address that, how does it work? And I missed the procedure part, so I don't know how to get back to the procedure.
Yeah, you can check. Would you like to know the how ECT, the procedure, what will happen on the day or the prior to, when you undergo the ECT? That's what I'm saying. Half of the time, the actor will not ask any question, because practically, if you are thinking about giving ECT to any patient in your clinic, do you think that person will be so responsive? He's got
Mhm.
depression to the extent that you are thinking of ECT. So they'll not be responsive in a practical aspect. So most of the time, the actor will not ask many questions. Ultimately, what happens is it becomes a monologue. You'll just go and just say everything. Check. Would you like to know this? At times they'll say, yes, doctor, please go ahead. All the at times they'll say, no, doctor, I'm not interested to know this. What else am I saying? This is what is a communication. In ECT, you can talk about many things. As long as you have checked and they said, no, I don't want to know, that's fine.
Yeah, yeah, yeah. Thank you.
Okay. If no other question, let's go to the next station.